Hello, my name is Joe Dugger. I own and operate a medical clinic in Searcy, Arkansas, One Life Direct Care. I've been a medical doctor for over 25 years, and I want to tell you about the LifeWave X39 stem cell patch. My sister-in-law asked me to look into these about 3 months ago and had not heard of them. So I was just going to let her know what I thought, whether they were legitimate or not. I'm a big fan of stem cell therapy, but the problem with stem cells is they are very expensive. They can be very effective. People can have regenerative benefits. For instance, you can get a stem cell injection in your knee, and it may cost $5,000 or sometimes up to $30,000 for those therapies. And there may be dramatic improvement, could even be some regenerative growth of cartilage, but it will be for a limited amount of time, and it's limited to the area where the injection occurred. So it's cost prohibitive and in many ways not a great long-term solution. These patches are non-transdermal patches, and what that means is they are not putting any kind of drug in your body. So they work by photobiomodulation, which is reflecting light waves or emitting light waves. In this case, the patch reflects your own infrared and causes the proliferation of certain peptides. With the X39, it's the GHKCU peptide, which is a copper binding peptide. And this in turn will cause a reaction in the body that switches on stem cells or activates stem cells. I'm a big fan of photobiomodulation. I've been looking at different technologies like class 4 lasers and hypersonic and some others to use in our clinic to help people with joint pain and just to help people keep moving. I've always believed that fitness and nutrition are foundational to good primary care and essential components for all of us to live a long and healthy life. And we run into these bumps in the road frequently, and even more frequently as we age, whether we're working out regularly or not. And so we can get sidelined because of a shoulder injury or a knee injury. Then we stop working out or we stop being active. And then fairly quickly we start to develop more problems from the sedentary and inactive lifestyle. But again, these lasers and these hypersonic machines that we can use for photobiomodulation are cost prohibitive. And I was looking at a $30,000 machine. I looked at a $70,000 machine. And so I was in search of something that we could use to help people move more safely and improve, kind of a repair and maintenance, if you will, type of program that we could have available for our patients and our community to help them stay healthy and keep moving. So when I looked into the details in this patch and I looked at the science behind it, I talked to some physicians and some other healthcare professionals that were using them personally and recommending them for their patients, and took a couple of weeks to do some research on them and came back very impressed with what I found, very excited about the potential for therapeutic benefit for really everyone, but especially for those of us who are over 30, I'll say. But really anyone, even children.
Hi, my name's Pat Davis, and I'm really excited to be working with Joe Dugger, my family doctor. We are seeing some incredible things happening with this technology, and we just want to share it with everyone. And it's really exciting that the things that we've been seeing. My wife had 2.5 years shoulder pain disappear after 5 days of wearing a patch. My blood sugar went down. Our son and son-in-law both felt like they had energy like never before, just destroyed workouts compared to before patching. Our daughter has seen significant increase in different areas of her health, and countless people that we've come across. So what we want to do is we want to make sure that everyone knows about this.
One of the links that I saw was a case report on someone who had fairly severe inflammatory bowel disease, ulcerative colitis in this case, and within 2 months on the X39, she was completely symptom-free. She had a colonoscopy that was normal. She had biopsies on her colonoscopy that showed normal colon. And this particular patient had had this disease for a long time, and it had been very resistant to all of the current treatments that they'd rendered. So that excited me. And the further I delved into it, just saw more phenomenal benefits, case reports of neurodegenerative disease such as Parkinson's, Alzheimer's dementia, getting better, tremors going away within a week in one case, in a man who had severe Parkinson's and a tremor so bad that he couldn't write or feed himself. So anyway, long story short, I saw dramatic and amazing benefits with these patches. And so I started recommending them. I recommended my sister-in-law to go ahead and start using them for herself and her family, which was her original intent when she asked me to look into them.
This technology is real. It's actually been around for over 20 years, this company, but so many new things are happening and new inventions and technology. We believe that the founder of the patches and the technology, David Schmidt, is like a modern day Edison or Tesla.
Natural disasters, all too real, occurring all too often. Getting medical aid and services to those who need it the most as soon as possible is always the goal.
When a company becomes successful, you have an obligation to help those in need and give back to those that are less fortunate. Usually what happens is there'll be some type of natural disaster, something will happen, and LifeWave members will respond immediately and say, hey, I'm trying to help out with this situation. Can the company get involved and provide some kind of assistance? And so the frustrating part for me is that these are people that need help now, not in a couple of weeks. They need help now. And so it was these type of incidents where I began to think that I would like to have the capability to provide medical aid, provide relief effort to people within a 24-hour period. And so the question was, how could we do that? Could we apply some things that we do really well, like innovation and product development? Could we put those skills to use and develop a system where we could take matters into our own hand and within 24 hours provide the relief that people need? Before LifeWave, I was developing emergency equipment for the Navy, and one of the things that I specialized in was power generation. So I was developing new batteries, new fuel cells, and in particular, a new type of turbine engine that didn't have blades, that worked with a novel combustion system and could provide power in an emergency on a submarine. So this was something that myself and my team were doing back in the 90s. And it started as something that we were going to do as father-son, but then as we began to innovate and develop, it became really obvious to me that we were doing something cutting edge. This was going to be much, much bigger than a simple project or hobby, and that we could help an enormous number of people if we applied what we were learning and doing to this project. So it started out pretty humble and simple, and it developed into something which I think today is incredibly extraordinary.
I've had a lot of pain and inflammation in my hands and wrists, in my knees. I started using the X39, and then within a week, I added the X49. And the anti-inflammatory benefit was apparent on day 3 with the X39. I'm 55 years old. And then I started recommending them for family and friends and patients, and have been on this journey now for 3 months, and just seeing amazing things on a daily basis.
So many people around this area are having their lives changed by this technology, and we just want to get the word out there. And by the way, there is a great opportunity to make a little extra income too, if that would interest you. God bless you and have a great day.